Hello everyone, I'm Dr. Shireen Saini and welcome to our initiative, What After Dentistry. As you all know, we are a team of dentists with healthcare management background and we are here to guide you through various career options in dentistry and healthcare. So today we have with us Dr. Merosha, a practicing dentist in Doha, State of Qatar. She graduated from Ahemdabad Dental College, Gujarat, and has over 5 years of experience working as a general scope dentist in the state of Qatar. She has an excellent track record of rendering preventive and restorative dental procedures and other treatment measures to her patients, ensuring that she always brings smile to her patient's face. She has dedicated her life to the dental practice and keeps updating herself with the latest trends in the field of dentistry and healthcare. We welcome you, Dr. Merosha, to join with us on our platform today, and we are really excited to discuss the scope and opportunities of practicing dentistry in Gulf countries. Welcome.
Thank you so much for an elaborate intro. Thank you so much.
Great.
I'm honored to be at this platform so that I can share something valuable for the candidates out there.
Thank you so much. So before we, start or with the discuss the opportunities in Qatar or Gulf countries, basically, we would like to know your experiences, or if you could please share your experiences and your journey with us after completing BDS.
I'm a graduate in 2013, and as you all know, journey of a BDS is not that cakewalk. It is full of struggles. And yes, I had my own. Though in India, I had very few years of experience, like almost of 2 years, in which I have learned a lot. I didn't plan for going into MDS because back then, MDS was not such a hype. Even a BDS could do everything which an MDS could do was a myth when we were studying in our college days. So MDS was not like compulsory, you need to do, right? It is right now, situation is in India is like after BDS, you need to do an MDS, is what everybody tells me. But back then in 2013, BDS would suffice for you to live, suffice you to follow your dreams. So basically, I just stopped my studies after BDS and I decided to go for practice. Let's see how the market is. Let's go into the big world of dentistry. And it was not a big, small, and it was not a easy way out. It was a difficult way out. I studied in a different state. I practiced in a different state. So that itself was a challenge in like studying in Gujarat and practicing in Kerala is two different things. There are two different kind of public, you're dealing with different kind of people. It is not the same people whom you dealt with in Gujarat. They are not the same people. So as soon as I was out of my dentistry, I had started facing challenges. And after practicing in Kerala, as every woman has to go through, I got married. And then immediately I was shifted to Qatar. So it was a roller coaster ride for me, going from different stretches of public, reaching out finally in Qatar. And here I'm settled since 5 years and happy in whatever I'm doing right now.
That's great. That's amazing. That's a very nice journey. Like, going from Gujarat to Kerala and then from Kerala to Qatar. Yeah, I can totally comprehend and understand what you've been through, and I think it's amazing. So, as you said, like you've worked only for 2 years in India. How long have you worked in
Gulf? It's more than what I have worked in India. India was only almost 2 years, but in Qatar, it's been 5.5 years now. I started off my journey in 2016 and I have 2 employees. Now I'm working with a second employee permanently since 4 years. It's been 5.5 years.
Oh, that's great. That's nice. Good to know. So, what do you suggest? I mean, what is the process if somebody wants to move to Qatar or maybe in any Gulf countries? What's the process of practicing dentistry over there after BDS?
Basically, after BDS, when you need to make up your mind. Suppose you're coming into Gulf, there'll be many reasons. One, there are different kind of people working in Gulf. One is handpicked ones from the employee. They are privileged. Second, there are a group of people who come to Gulf and search for job because they have a myth that there is money here. Third are people like me who are brought to Gulf without any choice because they get married. So, the main process when you are a dentist, if you want to work somewhere, you need to get your data flow done. These things you need to have in your hand if you want to practice in Gulf. So before doing anything else, get your data flow done, whichever country you're aiming for. Get your exam cleared of the particular country if you are not an MDS. If you're a BDS, you need to get your exams cleared. Sorry for that. Need your exams cleared. Then get your bona fide certificate, which is a new thing which the Gulf Ministry asks for. Bona fide certificates needs to suggest that you have been a student of this particular course in that particular college for 4 years. This is just to show the ministry that you have been not a distance student, you have been studying there for 4 years. So bona fide certificate is very important. Second is your transcript, which is encrypted, which is a mark list of aggregated mark list of the 4 years together. Then your experience certificate. All these certificates needs to be ready in your hand with attestation, that is notary from India. So if you don't have notary, after getting the job, when an employee employs you, you waste 25 days just to get the notary, which was a mistake in my part. So I don't want the candidates or newly joining to make this mistake. Get everything in your hand ready so that when you get employed by an employer, you just have to go through the process of licensing. Because licensing itself takes a month or 2. So in between that, if you have 25 days extra more to get your certificates attested, that is a waste of time. So get all this attested from India and then come to Gulf for searching a job, is what I believe.
I think that's great. So for what I understand is like the process almost remains the same whether it is any country in the Gulf, or every country has their own process. I mean, how do you define that? Like,
see, what I've heard of Qatar and Saudi, they follow the same thing, but the UAE, it differs. And main thing is getting a data flow of the concerned country. Like for you're working for Qatar, you need to get a data flow of the Qatar. For example, if a student is having already done a data flow of Dubai, he wants to shift to Qatar, he can do it. He just needs to change the data flow from that particular country to the other country. He need not undergo the whole process over again. So basically, these few things remains the same when you're trying for Gulf. It only differs is a data flow which has to be of the particular country which you are applying.
So once the data flow is done, then is it like every ministry or every country of Gulf country basically they have their prometric dental exam that every candidate has to sit for?
You have prometric exam concerned for every country. Like UAE conducts one prometric, but then Abu Dhabi has a different prometric. They have their own closed system, HAD, which is called as HAD. And then you have Dubai, another exam, and all other Emirates, they have different exam. Qatar has different, Oman has different, Bahrain has different, Saudi. So basically they have different prometric, which you need not come to the Gulf and write. You can write down in India only. You have various centers available in India wherein you can write down the exam. And now even you have procedures to get your half of your licensing also done in India.
Oh, great.
Is what I know, which was not there when I was trying actually.
Yeah, that's good to know. Also, I would like to know, like, if I want to sit for an exam, like
in Qatar, how it is like, if you want to get a license to practice, only then you need an employee. You can get all other things done by yourself. Even an employee is not going to recruit you if you don't have all these things ready. It was not, the scenario of Gulf is not like back it was in 2000, like when I came. It has changed a lot. And now you need to have everything ready in your hand because Gulf market is also getting saturated actually. So you need to get all your work done before you are going for a search of job. So you can give your exams anywhere, either in Gulf or in your country. Irrespective of getting a sponsorship or irrespective of getting a job, that doesn't matter for giving an exam.
Okay. So maybe I might have not understood it clearly because even in Dubai, it is the same way. For licensing, sponsor, you need to get your eligibility letter converted to a license. So I think
Okay. But one of my friends last week, he got a job in Dubai, but he had all his papers ready beforehand. Like he gave his exam from Trivandrum. He had his data flow done from for the Dubai ministry. He had all his papers registered. He went 2 times to Dubai for the search of job, and in the third attempt, he got the job. So I guess everything was done prior. I don't know if
no,
anything. That's last week I spoke to him.
the license part is what I'm talking about. So
You need an employee.
that's what even on the DHA site I went. So that is why I wanted to confirm that is it the same, all
It
over.
is the same in Qatar. It is same in Gulf country. It is same, and that's what I said. There are different kind of people working here. One which are handpicked, like when a clinic has a necessity of some doctors, like they want a surgeon, they want an endodontist. They connect to the recruitment agencies back in India, and they handpick the best ones. Those are brought here, and those people, they don't have to write exams. Like in Qatar, MDs in the clinical field, they need not write exams.
If they are
It's
hand,
only for they don't have to write the prometric exam. The MDS in the clinical fields, apart from OD department and oral path department, they have to write because they cannot practice here. It is not a clinical field. They have to write the exam and they can practice only as a general dentist. But MDS, like surgeon, endodontist, orthodontist, who have an experience which the ministry approves of, they can directly come here and work without giving an exam. They just have to give an interview with the ministry to get the license of the concerned field.
I think that's great. That's good to know. What is the total time and the expenses like on an average? If you can, tell us the total time which is required for starting from the application till you get the license, and also the processing fee. In Indian rupees, you can give an average amount for the candidates to.
Yeah. So for the things which I told, like data flow and these things, data flow actually cost you around 20,000. When I did it, was 20,000. I did it from Gateway Consultancies in Calicut. So I was charged around 20,000 only for the data flow, and then certificate, bona fide. This all your college will give you, and the place of work. It does not require that much of expenses actually. So that can be given by your college or your concerned person whom you are working with. Then you need the notary attestation, which costs you, because this has to go to Delhi to get attested from the India, and then you have a Qatar embassy in Delhi who also attest it. So that takes time for 25 days and costs you around 10,000 rupees. So overall, to get your certificates ready, it will cost you around 30,000 and 1 month of time, maybe 1 month to 45 days. So this is just to get your papers clear before you come to Gulf. And to write your exam, it was 715 Qatar Riyal in so maybe around 15,000 Indian rupees to write your exam. 12,000. And then when you come to Gulf, and by God's grace, an employee finds you as one of their set and they recruit you, then you have to go through the process of licensing and that evaluation. There are two process stages. One is evaluation, where the ministry, they just overlooks your certificates to evaluate you, that you are applicable to apply for the which scope dentist, because whenever you apply as a general dentist, if you don't meet the criteria of that concerned ministry of the country, they will put you under a training period for some months. So that is a time of evaluation. In evaluation, they decide what to give you. Either they can directly go for the scope of dentistry, or they need to do a training period of 3 or 4 months, how much ever time. So that is how it does. So for that, it will cost you around 1,000 Riyal is the licensing charge, and that is around 20,000 Indian rupees for the licensing process. That I guess employees should bear if you are handpicked. If you are not handpicked, if you go and search for a job, you have to bear the expenses.
Okay, so it's like almost like total of like around 65, 70,000, if I understand this. 30,000 for the data flow, 20 is for the licensing, and then 15 approximately for the exam. So
Exactly. So
it comes around 65, 70,000. And how much is the time? And I mean, like, how much time will it take for a person?
License is all on, actually, licensing procedure is all on your luck, is what I feel, because I had my friends who we all have applied. 2 people, 3 people applied together. I was lucky among them. I got it in 1 month, but some people, they got it in 2 months. One was in 6 months. So it all depends on, see, why the licensing gets delayed is what I understood is, After evaluation process starts your licensing process. And during the licensing process, there is one certificate, which is known as good standing certificate, which has to come directly from your college to the ministry. So you need the timing. You need to calculate the time actually. So when you apply for the licensing, I was a person who was not handpicked. I had searched for a job, so I know the whole process of licensing. I have gone through this shit. I've gone through that struggle. So it's basically, the thing is, it's all calculation. You have, as soon as you finish your evaluation, it takes 15-20 days more for the licensing procedure. You need to contact your college and let them know that within a week or 10 days, you need to send the good standing certificate, which was initially, when I was applying, it used to come from Dubai. But after that, there was a blockade, and the FedEx would not deliver from Dubai. It has to directly come, long route. So when I was applying, it came from Dubai, and it took 4 days, 4 working days actually, and they used to send in Tuesday. So Friday was a leave. So I calculated, I told them what to do. The same day it was delivered. Now, what is the positive thing of your good standing certificate reaching the ministry on the calculated time? Because after evaluation, the 15 days, they are concentrating only on your papers. So in that 15 days, if the good standing certificate reaches there within 10 days, they have your good standing certificate, and then your license is approved. For example, within that 15 days, your good standing certificate does not reach there on time. They're going to keep your application aside, and they're going to concentrate on the other applications, because there are lots of applications going on. So for example, there are 20 applications after you. It is going to take time. They're going to revert to you only after that 20 applications. So that is how it takes time. So licensing procedure is basically calculation and getting your papers ready on time.
That's
very important.
Yes. This is a very great piece of information that you've shared with all the candidates. And I'm sure
I give it to everybody, because I know the pain of the people who have gone through it. And I was lucky enough because it reached on time.
So that's great to know. Thank you so much for sharing this information with all, with us. So, like now you've been working in Qatar for almost like 5.5 years. What do you think is the scope of practicing dentistry in Gulf countries or Qatar? What is your take on that?
Gulf is basically when I came here, there were many people who guided me, and Gulf is all about opportunity, seizing it at the right time. Also, reaching the Gulf on the right time is important. For example, if you reach at the age of 40, you're not paid well. Like initially, see, in Gulf, what matters is how much of experience you had in Gulf is more important. Okay, as I said, I have more experience in Gulf than in India. So even if I start searching for another jobs, I'll be valued more, because my CV contains experience of Gulf more, which is very important. It is an international experience. Unless and until you are handpicked from India with 10-15 years of experience and you're brought to Gulf, you're privileged. If you're coming by your own and searching job, after 10 years of experience, you're not privileged. You have to go through the struggle. You need to go for the job. You need to prove yourself that I'm fit for this job. I'm in a site for your clinic. You need to prove yourself. So that is, my initial years were very struggling, because I had only 2 years of experience. I would go to an employer. I can't negotiate with the salary because I had a very mere years of experience. So I had to prove myself. I had to do my best. So it takes so much of years. The scope, when I was starting my job here, the scope for the BDS was deteriorating. And now it has saturated, but I won't demoralize anybody. I won't demotivate the candidates who are trying to come here. I would just say, come try. Still, you have opportunities. It's just the survival of the fittest. You need to work hard. Don't get dejected after 1 year. Oh my God, I tried for Qatar, I didn't get. No, try after 1 year. I personally speak, I still have the list of 30 clinics where I visited and give my CV. 31st clinic recruited me. So it is just matter of hard work, patience, and definitely you will get through. Though it is getting saturated, probably you're the one who has a skill and opportunity, and the employer recognizes you, and you just need to seize that opportunity. So I won't demoralize anybody. Yes, still the market is open. You just need to seize that right time and right opportunity.
That's amazing to know. And as you correctly said, it's like one has to be persistent, and one has to keep trying till they succeed on what they want to do. So yeah, exactly as you said correctly, it's great. So then, what is the starting salary range? If I talk about Qatar or maybe Gulf countries, if you can talk, or you can let us know the average salary that is paid.
So it's a debatable actually. Not everybody is paid the same. You have two employees of the same age working in the same clinic, they're not paid same. It all differs. And what is it based on is your experience, your talent, your skill, and how much you're useful to the employee. Unless and until you're handpicked. Handpicked, they are privileged actually. They're brought with certain, so obviously handpicked are those who are either very good in their fields back in India or who have been toiling in this field since years. They have been brought here so that they could do good for the employee. So if we speak of Qatar, the initial range which a normal general dentist can expect is 7,000 to 8,000 initially. But if you have less experience, then you have to go with what you want, what they give you actually. And then MDS is 12 to 15, but then there are some clinics who give you incentives, and so it is subjected to change. Definitely, as years grow, it is going to be much better. So what and after after saying all this, I would just say one thing: if the person who is willing or who's wishing to work in Gulf should not be concerned about salary first. Okay, should come and try, give their best. Survival of the fittest is the motto here. You need to seize that job, get it, and salary is going to flow to you. That's it. That's what I learned actually.
I
So
think
that's
that,
what I will also suggest to others.
yeah, this is what I mean. Not just dentistry, everything that you do. I think it's one should not focus just on salary for when you're starting your career, especially because eventually salary will always increase as and when you grow in your career. So that's I mean that's a fact that we have always been. But then there are, yes, most of the candidates, the freshers, especially the students, they are morely focusing on the salary part. They always focus on the salary and not
Yes,
job.
I want to let them know. I want to let them know. Unless and until you sell yourself, how can you expect a good job? So how can you expect a good salary? I'm sorry. When you contact somebody for a job, and then how is he or she, obviously they have their own clinic. How are they going to decide whether, how can I give you 8,000 if I don't know you, how you work? You have come to me for a job, asking for a job. I have not handpicked you. You have come to me because I'm growing, I'm working hard, my clinic is doing good, and you come to me, you want a job. Unless and until you prove yourself to them, how am I supposed to take the money and give it to you? So it's all about, that's what I said, I am differentiating people who are handpicked, and I'm differentiating the people who are wanting for job and searching their job by themselves. It differs a lot, matters a lot. So whoever asks me what is the salary, I tell them this is a basic salary, what a BDS should expect or negotiate with. But do not go behind it. It will fall into place. But first you need to, because working in Gulf is not same as working in India. It's very different. You're dealing with lots of people. You're dealing not only with the local public, and that too, the rules, I'm not talking about like, rules are very strict over here. Let's speak it that way. And general dentists can't come to Gulf and do any treatment which they like what they are doing in India. We have seen in India many people are doing implants and surgeries, and but there are some rules and regulations which a ministry follows in particular country, and you need to abide by that. So suddenly a fresher coming up from India coming into Gulf, and I will do implant, I will do this. No, it doesn't work that way. You need to start, first of all, you need to start your journey. You need to learn new things. You have people working with you. You are dealing with a different kind of people. You're not dealing with Indians anymore. It's very rare you deal with Indians. You're dealing with all race of people. You're dealing with Arabs. You're dealing with Caucasians. You're dealing with Asians. You're dealing with, all different kinds of people are going to come and meet you. So if you don't sell yourself properly, you can't demand for anything. Is what I feel. That is my personal opinion. The rest is how people perceive it.
But I think you put it very correctly. And now, since you said that it is very different of how of working in Gulf and working in India, so I would like you to elaborate on the same. That how different is it like? How different is
Uh,
in Gulf?
First is rules. You are bounded by rules. Suppose if you are you're a general scope dentist. You have some core privileges which ministry gives you. You can work only in that core privileges. For example, we are supposed to do only root canals of single canals. If it exceeds to double, you need an endodontist to work for it, unless and until it is a non-complicated cases. Similarly, extractions, impacted cases, they are kept only for surgeons. You can't, a BDS can't go and just remove an horizontal impaction. No. In India, we can do that. But here, you are bounded by some rules and regulations, and that's how ministry works. You can't go and question them. I know this how to do it, but no, they are not allowing you to do so. You should not. Basically, a BDS can do all the procedures, but the big ones are kept for the stalwarts. We can't do ortho here because it's only kept for an orthodontist. We can't do implants here. You cannot do implant if you're not an implantologist. There are very few implantologists in Qatar. We can count them on fingers. Very few. Because even if you're a surgeon, even if you're a prosthodontist, you're not privileged to do an implant unless and until the ministry gives you a privilege of doing an implant. So it's very different. This is the first difference I found. The second difference, which every new candidate faces, a language barrier. Working in UAE, you can have English, Urdu, se kaam chal jayega. Like Hindi, if you know Hindi, you can work. But countries like Bahrain, Saudi, Qatar, knowing Arabic is very important. If you don't know Arabic, you're not dealing with local public. If you're not dealing with local public, then I feel there is no use of working in Arab country. If this is my perception, like if you don't live in Rome, live like Romans, is what I feel. If you're living in Gulf, treat Arabs. That's why you're here. So not only Arabs, in the clinic which I'm working with, I have Qataris coming to me. I have, that's what I said, I have Caucasians coming to me. I have Americans coming to me. I have Africans coming to me. So you have a hell lot of people coming to you. You have to deal with, every human being is different. So you need to be confident in your work. You need to present yourself well. You need to sell yourself well to do well. So this all starts with a mere, a thought of learning. When you join somewhere and you have a thought, I was very young when I joined at this institution, or the clinic, and I joined at the clinic just mere of learning new things because I had a very few years of experience. I was not that big doctor or so. Whatever I learned is in the process of learning, and after 5.5 years, I could somewhere at one person I say, yes, now I can do some things. Now I can sell myself. Now I know just how to treat a person in Gulf country. Now I can survive is most important. Because when you deal with different kind of people, you need to deal with different kind of natures of the people. Arabs are very short-tempered. You need to deal with them. Back in India, it's like, you talk, the patient is going to listen because you're a doctor. Gulf country is not like that. So, these things are very small things which you need to know. That's why I said it is survival of the fittest. There are many stalwarts who get handpicked and come, they can't work. But those people who have toiled here, worked hard, they have heard everything, they have gone through a lot, maybe they become a lotus of a lake that way. So it's, these kind of things is what I feel difference. And second, the most important difference is you get updated every week with a new technique. Because you're working with the latest technology items over here. You're working with people who are very, diggaj, we say, who are best in their fields here. For example, the atmosphere where I'm working with, those handpicks one are the best ones in India. So you get to learn a new thing. You're working with a group of doctors, multidisciplinary action. For example, you have a case where you need extraction and implant. So you have an implantologist ready with you. You just extract and he's going to put an implant. So you see the procedure of doing an implant immediately. You are assisting him. You're giving a suture. You're removing the teeth. So, it's a multidisciplinary action. Right now in India also it is coming up like that. That's what I heard. Many clinics, in big cities, many clinics are doing a multidisciplinary work. 2-3 doctors together are treating the patient. Similarly, we are updated over here. That's more important because first of all, you're practicing internationally. The most important is getting acquainted with things, because you have patients who have already treated themselves in America, who have treated themselves in Europe, and they come to ask you, where is this thing? This doctor did it that way. You don't have these things. So, we need to be updated. We need to be, at par with all the dentists all over world. So, yes, that's what I think a very positive side of working internationally, working in Gulf.
And absolutely. And also like what even I have seen is dentistry, what was practiced like even 5 years ago is completely changed. So every passing year, dentistry is also, it's increasing the advancements, the technology side of dentistry, everything has been like on a rise right. So one last piece of advice that you would like to give to fresh BDS graduates or anyone who's trying to, move to Gulf countries for practicing dentistry.
Get your papers ready on time. Do not, do not waste your time after getting an opportunity, because Gulf is all about opportunity. If you get that opportunity, you just need to seize it. Before that, do your homework. Get your papers ready. A. Second, if at all you are handpicked, for example, even a fresher can get handpicked if you have contacts in Gulf. So if you are handpicked, try to do your homework first. Try to get the background of the employee first. It's very important, because there are many cheatings which I have known. My friends have gone through. They have been recruited by some of the well-known recruiters back in India, and their money has gone because the Gulf people, they didn't recruit well. They come to Gulf, they work for 2 months and they're not paid well. That's why I said make your homework, search about your employee well. Second, whenever you're for a fresh BDS, what they are told about Gulf is, पैसा है, कोई भी recruitment agency पे जाओ, job apply करो. It's not like that. When you approach a recruitment agency, know the authenticity of that recruitment agency. What they are doing is correct. Do not waste your money. If they ask 2 lakh lagenge visa ke, don't give them money. Make your true contacts in Gulf. Call up wherever you find, because there are n number of groups available in Facebook and WhatsApp where dentists are working in different parts of the world. So definitely in Gulf also you may have some people working who you may via like your friend's friend maybe. Call them up, talk to them personally. What is the scenario? Do your thorough research and then set out for this, is what I would give them as a piece of advice. And last but not the least, as a fresher, do not aim for the money and come here as a student, learn a lot from here, and then money is going to flow. Once you set your practice, then there is no looking back in Gulf. But you need to get to that position. For that, learn, because you're just a fresher. You need to learn a lot. So come here, get associated with one of the good companies, whichever employees you make your research, and come here, utilize that opportunity to learn. And after 1 or 2 years, then there is no looking back.
That's amazing. That's a very, very good piece of advice that you have shared, all the insights. So, as Dr. Merosha put it very correctly, do your research, do your homework, to have all your documents ready before you come to Gulf and start application or start all the process. Of course, don't run after money. Money will flow if you are really good in your skill. So I think very, very important aspect of dentistry or anything that you intend to do in healthcare is to learn a skill, master that skill, and definitely then showcase yourself, and then you just need to present your best of the skills that you have. So I think that's really, really great, Dr. Merosha, that you have shared with us all the experiences, your journey, and the advice that you've shared with our candidates. Thank you so much for coming on the platform and sharing.
Thank you, Dr. Sharon.
Most
Thank you for having me. Thank you for having me. At least it was for a positive motto, and I hope some people will get benefited out of it. Those who are dejected, like nahi ho raha hai hamara, kuch ho nahi raha hai, don't get dejected, don't get demoralized. Aapka bhi din aayega. After 5 years, you also will be sitting here and talking like me. So let the time flow, and you also just go with the flow and do what is necessary.
Exactly. So, exactly. Thank you so much.
I came into dentistry by choice, by chance, but now here I am by choice. So that will change.
That's really amazing. Your journey has been really amazing, and I'm sure many people will get motivated and they will get inspired by this session that we had today. So thank you so much, Dr. Merosha, for sharing all the insights and having, coming on our platform and sharing everything. Thank you so much. And to all the other all the audiences, thank you for patiently listening to our session. Please like our session, share this in your network. This might help somebody to practice dentistry in Gulf or Qatar. I will see you in the next video. Until then, bye and good luck.